I'm Mike Forsyth. My co-host is Matt Clark, and this is Beyond the Limits. Matt, how are you doing?
Oh, I'm good, thanks. Mixing it up there, Mike. I like that. Keeping us on our toes with the intro, very good. Yeah, I'm good, thanks. I'm excited to talk about this topic. We're talking about VO2 Max testing today, and this is something I've known about for a little while from thrashing myself on my bike previously, but I think there's significantly more than meets the eye when we're looking at this a bit closer, and I'm really looking forward to getting stuck in with it.
I completely agree. I'm not a triathlete who has represented Britain or whatever it is, but and I have been vaguely conscious of VO2 Max, but not in a huge amount of detail. But actually, we were perhaps both a little bit apprehensive about talking about this topic. But as you say, the more we look into it, it's really interesting. So hopefully all our listeners will find it interesting too. Matt, let's dive into it. Hey, so do you want to kick us off? What is VO2 Max? What does it stand for? And why is it important?
Yeah, okay, I'll take the reins here. VO2 Max, there's lots of vague, slightly just off descriptions of what this actually is, but the definition I'm going to give you today is that it's the amount of oxygen that you can consume or that you can utilise when exercising, and it's measured in volume per minute, so it's literally the volume of oxygen that you can consume in an amount of time when exercising. To simplify it, people have described this as the size of your engine. So, the bigger the engine, the faster it can go. But I think I'd like to give a slightly different take on this, and bear with me. But I'm thinking of this it's more of an orchestra. It's an orchestra basically playing the most challenging symphony. If you imagine to get to your VO2 max, everything has to be working in its peak form. Your airway, you've got to get the air into your lungs. The air has got to go from your lungs into the blood. It's got to get to the tissues. It's got to get pumped around the body by its pump, and it's got to be extracted from the blood into the tissues and then utilised. And it's how much oxygen you can use in that time. And to get the maximum response from that, all of those parts, all of the instruments in the orchestra have to be playing on form to achieve that symphony. And I'll give you some average values. So to get some actual numbers to this, bear with me, I've got my chart down the bottom here. And I was actually shocked by some of this as well. But unfortunately, it does go down with age. But we're looking at, so this is for men, and it should be said that it is different for men and women. There is a genetic predisposition to how high your VO2 max can be, and that's kind of well documented. But some average numbers here. So if you're considered excellent, so how old are we, Mike? Are we still in the 30 to 39 bracket? Just about. So if you are excellent, you're getting something over 50, but if you're, say, fair to average, we're talking somewhere between 20 and 35. Elite sportsmen and Nordic skiers seem to have the highest VO2 max levels recorded. They're in the high 90s. So that is, pretty much double, isn't it? Whereas Olympic rowers are in the mid 70s, track and field runners in the high 80s.
Yeah, that's similar numbers to I read actually. I actually saw it's even higher. That I don't know why it's always Norwegians. They must be very good at endurance, but Norwegian triathletes even potentially have numbers over 100. Your classic kind of Tour de France cyclist can be up in the 80s or 90s. So big numbers. I think you're right to point out that it's slightly different men and women. So if we take, for example, say we take a woman 30 to 39, again, similar to men, but I guess we're looking at kind of excellent over 49. Good is 40 to 48. Average is your 33 to 39, I believe. I think these are probably similar numbers that you've seen too. So a big old range, but I think quite a nice description there of exactly what that is.
Yeah, just chiming on about this again. So there's lots of variables that go into the VO2 max. To get a very high number, like I said, all of the parts of the orchestra have to be playing their tune. There are lots of variables that go into that. There's some of which you can't change or you are non-modifiable, such as your age, for example. So I think we're all aware that VO2 max and kind of athletic performance does unfortunately decline. This peaks in your early 20s and it goes down. I mentioned also that genetics, there's also kind of hundreds of genes that have been identified as being linked to this. there's lots of things that we can modify, such as whether or not we smoke, whether or not we're on medications, whether or not we're hydrated, whether or not we're anemic. Lots of these factors play into, like I said, this orchestra. And I think it's a test, essentially, of every single organ in the body firing at its peak rate. I did actually kind of go through them, and I thought, other than maybe the brain, but I don't know if you've ever done a VO2 max, but actually I think when you're doing a test, it takes quite a lot of kind of psychological willpower to not actually get off the bike. So I think your brain is actually getting tested in some degree as well. Now, I've rattled through kind of what VO2 max is, some of the variables that contribute to it, but I guess, Mike, do you want to tell us why is it important?
Yeah, totally. And this is the area that I think is really interesting. So VO2 max for me had always been something that athletes or people who really good at endurance events, high level, high performance could gloat about or could have a look at, and that could give them an idea about their training load perhaps. I mean, those of us who have smartwatches and go for a run, you may find that it pops up with not only your split times at the end, but your VO2 max, and you look at it and you think, great, that, I'm really fit, or otherwise, in my case more recently. But actually, potentially the more interesting side of this is as a predictor of life expectancy and essentially longevity. So I'm going to read, first of all, just a quote from the American Heart Association. So cardiorespiratory fitness, so CRF, is a potentially stronger predictor of mortality than established risk factors. At a minimum, all adults should have cardiorespiratory fitness estimated each year. And again, here's a study from Cleveland, from the JAMA, I think in 2018, looked at 122,000 patients in a retrospective cohort study, saying that cardiorespiratory fitness is inversely associated with long-term mortality with no observed upper limit of benefit. So what this is saying, which maybe is an obvious comment, but your cardiorespiratory fitness is hugely important to work out how long you're going to live for, how long you're going to be healthy for, I guess. And what is an accurate or an effective way of measuring one's cardiorespiratory fitness? It's by seeing your VO2 max.
Can I just I just want to really emphasize a point about that study, because I looked at that as well, the one of the 122,000 in the JAMA in 2018, to give our listeners a bit of context. Because you said how the American Heart Association has recommended that it's a more important statistic than all other independent risk factors. Just looking at those numbers, so it categorised people from doing their VO2 max test, which is what we're talking about today. It categorised them into 5 categories: very low, average, above average, good, and elite. I may have got the names of those categories wrong, but what it said from those 5 categories, if you went from the lowest to the highest, this is a 5-fold decrease in your mortality over a decade. And if you're going from the lowest to the second lowest, this is a more significant improvement in your 10-year mortality than if you were to have diabetes, or if you were to have coronary artery disease, or end-stage renal failure, or high blood pressure. We're talking about huge improvements in your 10-year mortality, more so important than whether or not you have one of these huge risk factors that we're always being told about. I just wanted to kind of chip in with that. And the last point, sorry, before you move on, because I think it's important, is that this correlation that this study showed was this monotonic correlation. I mean, in medicine, we're always looking at bell curves and kind of S curves or J curves. These improvements tend to kind of wane when you get to the extremes, whereas this study showed that the fitter you are, the benefits, continue to improve. It's not a case of, you just need to add on 20% and you get a bit better. If the fitter you are, the lower your risk gets.
It's quite impressive reading, really, that, I think, and really highlights that interest in VO2 max, perhaps. Now, Matt, as an elite athlete yourself, I'm conscious that you have gone and undergone some testing, checked your VO2 max. For those of you who don't know, Matt is just one of those infuriating individuals who just seems to have really annoying natural levels of fitness. So I'm assuming when you did this, you came out and all of the reports suggested you should be, representing your country in the Olympics. Is that right?
No, no. And the classic kind of humour of Mike Forsyth stitching me up there to say about my VO2 max testing. No, I'm not anything special, unfortunately. I have, however, done a cardiopulmonary exercise test, or a CPET, which is what I can move us on to next.
And it's probably worth just pointing out this is the gold standard, right, to accurately assess someone's VO2 max. So paint a picture for us, Matt. Tell us what you have to do in order to accurately assess this.
Yes, for some reason I decided to go and get this done almost as this self-analytical, non-data, keen on numbers, weekend warrior triathlete who I went and did this with a friend, and it was really interesting to have it done, but it was absolutely brutal. How this is done is you go and you have a very tight-fitting mask put on your face, one that you have to breathe exclusively in and out of, so there's no leak. And then you sit on an exercise bike, or you can do it on a treadmill, and you slowly go through these slowly, progressively harder ramp tests. I think they're in minute blocks or 2-minute blocks. And you slowly go through this, and you just keep going until you literally cannot go any further. And you're breathing in oxygen, and then the machine is detecting how much oxygen you're expiring, so the difference between in and out, and how much you're utilising. It was it was a really fascinating study, actually. It was done at the University of Bath, the team there, and they do lactate testing as well, so you have to do a few blood tests and things, but it was absolutely brutal, and they gave me a wealth of information, this huge PDF document afterwards, which showed me all the various thresholds and tests. But I came away thinking, am I better for knowing that? Am I disappointed with my feeble score, or should I have just kind of looked at my smartwatch or some other kit? Now, I'm aware that you've been testing out a few of these, Mike.
Yeah, because I think it's worth pointing out, just with that CPET testing that you're describing, is that's clearly the couple of issues there. One is it's not hugely accessible. As you said, this was something you had to go and do in a specialist unit. The second thing is it's brutal, and I think there are a lot of people who wouldn't be able to do this. There's even more who wouldn't want to do this. So this is gold standard in terms of providing you with a really accurate individual VO2 max. But there are other ways of doing this, and or at least other ways of estimating this. And I think that's the key word there. But you're right, I've been looking more into the side of these smartwatches and something called seismocardiography, which I'm also going to touch upon. So I alluded to this at the start. So those of us with smartwatches will see that at the end of a workout, from time to time, suddenly our smartwatch will beep and it will say your VO2 max is whatever, and it will give a number. And for many of us, it's largely meaningless, other than whether it's higher or lower than previous. But actually, these smartwatches, these activity trackers, can give an estimate of your VO2 max. The way they do this is they essentially combine your resting heart rate, your age, your gender, your weight, and then potentially some other personal information, and arrive at an initial value. So that can be made more precise using the relationship between pace and heart rate during your runs. This is because individuals with a higher VO2 max have a lower heart rate whilst running compared to individuals with a lower VO2 max. So you do have to run. You have to run for about 10 minutes, typically, although it varies from device to device, and you potentially need a device that tracks your GPS as well. But what that can give you is an estimate of the VO2 max. So clearly much easier than doing CPET. The obvious question is, how accurate is this? And I think we'll come on to that shortly. Now, the device that I tried out recently, and it's one that I think would be quite interesting to talk about, is it's called SeismoFit, done by a company called Ventraject. I suspect there are other companies that do it, but this is the company that they used. And this is essentially called seismocardiography. This is a small device, probably the size of a matchbox, that you place on your sternum. It connects to a smartphone, and in less than 3 minutes, lying quietly at rest, it will give you an estimate of your VO2 max. Essentially, it uses machine learning, again, takes into account your age, your gender, your weight as well, and then can actually give insights in terms of your seismocardiographic signal, so your amplitude and morphology as well. So it's quite interesting tech.
Can you just can I just pull on that thread? So what is it? How does it differ from a smartwatch then? What is this seismographic bit? What is it picking up?
Yeah, so my understanding of this is that whereas the smartwatches are very much, as I said, looking at that relationship between your heart rate and your pace, and combining those other personal characteristics to come to a reading, The seismocardiography device, it's measuring the vibrations of the chest wall caused by your cardiac activity. And actually, the feeling is this can provide data on a few things. So your cardiac timing intervals, so your what we call your pre-ejection period, your left ventricular ejection time, can also look at heart contractility and mechanical function. And whilst it can't measure your oxygen uptake directly, you haven't got a tight-fitting mask here, you're not exercising to the degree that you described, it can estimate your cardiac output and come to what is felt to be a reasonably good estimate of your VO2 max. I think the couple of points here to make is that we are certainly not suggesting that either smartwatches or seismocardiography is in any way as accurate as doing a full-on CPET test. But the question we have, and the question that we've debated actually before this episode, is whether the estimate is good enough. And actually, given what we know about VO2 max and given the issues in terms of accessing CPET, is there any benefit to this? I know you didn't get a chance to try it yourself, Matt, but I don't know what your thoughts are on this, having heard all of that.
Yes, I guess I'm a bit sceptical because I tried my damned hardest to describe this beautiful orchestra working in harmony at the top of the show, and then I'm kind of imagining how these machines try and estimate your VO2 max from literally just from the force detected from your heart when it beats. Now, from my research, I have found that the cardiac output is the most important variable or the most adaptable variable in VO2 max testing. So it's the one that you need to train. It's the one that actually can improve the most, and that's the one variable with age that declines that determines your drop in your VO2 max, and that's because of your maximum heart rate declining with age as well, which I thought was interesting. That's the most that is the variable that goes down the most with age, so you can't get your heart rate above a certain top gear, and that means you can't pump the blood as fast, and that limits what you can achieve in terms of oxygen consumption. Now I'm kind of thinking about the orchestra and thinking about, well, what about the gas exchange in the lungs? What about the anemia? What about the oxygen transportation in the cells? And about the heart's ability to refill or its compliance. There's just so many metrics. There's so many things that we've not even discussed, like the kidneys continuously working hard to make sure your blood's not getting too acidic, your liver metabolizing the toxic byproducts of exercise. There's so much in there that is overlooked when you try and simplify such a metric that I'm a bit skeptical by some of these tests that just say, oh, we can chuck an estimate. Is it accurate? What I am intrigued by, what I've been impressed by, is how the smartwatches, like you said, some of them offer you training plans. It studies your data and it puts it into an algorithm. You have to tell it your height and weight and your age and things, but then it studies your performance on runs, and you can actually do some tests on some of them that help determine good estimates of your VO2 max, and that's considering a lot of things, and that's considering like how hard did you thrash yourself on that 10k run and how quickly did your heart rate settle down, and those things do give you an indication of how well is your orchestra performing and how well can it settle down again. I'm a bit skeptical about the Seismofit just looking at the force of how powerful your heart can be, and I'm sure that's an important metric, but I have to say I'm a bit skeptical.
Yeah, I think that's a fair comment, but I would probably counter with saying that I don't think anyone is claiming that it is perfect, and as I've alluded to already, it's not the accuracy of the gold standard, which is a CPET. I mean, it's difficult to find, so let's have a little look at the estimates of error and how far out they could be. I think the feeling, it's a different way you read it, but potentially kind of 7 to 10% error in both the smartwatches and your SCG, so your seismocardiograph. There was a feeling, I read somewhere, that it might be that the seismocardiography overestimates your VO2 max, whereas a Garmin or a smartwatch underestimates it, but they both stay within, well, depending on whether you think those are acceptable limits for non-clinical use. Interestingly, having tried out the Seismofit compared to my Garmin, I did get quite different readings, but actually the other way around. So my Garmin thought I was quite fit, or very fit, and the Seismofit wasn't convinced. I think it's just to go back to that point of the Seismofit. I think a couple of things where errors can happen because it's measuring those vibrations, those cardiac vibrations. So it's potential to get kind of artifact or movement. So if you're not lying entirely still, that can impact the accuracy of this. So look, I think everything, your skepticism is warranted. My takeaway from this, though, is that I do wonder whether there's a role here, given what we know about VO2 max and how important it can potentially be. When we're sitting in clinic with a patient, or if we are on a ward round or whatever, it's very common for your GP to look at your risk factors, so measure your blood pressure, your cholesterol, your heart rate, your family history, all of these kind of things, and plug it into a calculator and say, you have 8%, you have 12% chance of having a cardiovascular event in the next 10 years. That's the Q risk formula that we would use. My feeling is there could well be a role here for something that's very simple, a device that can just be rested on someone's chest. They don't need to go and strap an oxygen mask or a breathing mask on their mouth. They don't even need to wear a smartwatch and go for a 10-minute run. They can lie in clinic, have it popped on their chest, and yes, we may be 7 to 10% out in terms of accuracy, but it can give us a little bit of an estimate. If nothing else, that could act as a wake-up call to someone to think that their fitness might not be where it could be. Now, as you alluded to right at the start, a lot of this is genetics. Some of this we can't change, but actually some of this we can. And it may be that those modifiable factors can really be looked at. And actually that leads us on quite nicely to improving your VO2 max, or at least addressing that. And I know you've been looking at this a bit, Matt, and probably know a lot more about this than I do.
Yeah, that's a really good point you made about that bit of kit and how its practical use cases are very beneficial, aren't they? Especially when we're contrasting it to something called the CPAP, which is wildly impractical and pretty unpleasant to undertake. So yes, how do we improve our VO2 max? With difficulty is the short answer here. We've already discussed, haven't we, that there's a genetic component to VO2 performance. There is also this age-related decline that we've outlined already as well. I don't know if our listeners will understand the zones of exercising, but we talk about this zone 2. This is the gentle exercise that you can kind of do continuously. You're not pushing yourself too much. This exercise does not really improve your VO2 max too much, but I think it's fair to say that you need to build the base of a pyramid before you can put in the peak. There is a certain amount of conditioning that is required to get to the next step, and you certainly can't just go out and hit VO2 max session after VO2 max session trying to just improve it by getting to that point. But the crux of how to improve your VO2 max lies within getting as close to it as you can for as long as you can, and that is ultimately the way you're going to improve your VO2 max. It's incredibly hard to reach this optimum peak of your exercise performance, and getting there takes quite a lot of hard work. It has to be a long and gradual warm-up. You have to increase the blood flow to your muscles to allow them to perform. You have to go through the gears to get there. This isn't something that you can quickly jump to. Now, I'm aware that there's lots of different kind of ways in which people will be told online about how to approach doing VO2 max testing or improving, and I think there's lots of different ways. There's these kind of Norwegian 4x4s, there's this fartlek training, all a form of high-intensity training, but coming back to it, it is getting close to your VO2 max for as long as you can. That is ultimately what improves your VO2 max test score. Now, whenever you're kind of doing this, I don't know if you'll go out and do your high intensity training, people will often say, "Oh, I'm limited by my lungs, or I'm limited by my calves or my thighs, or whatever it is that limits them." When you're trying to achieve your VO2 max, it is the thing that limits you. It is most often that which will improve by testing. Like I said, that orchestra has to be working in symphony to create the masterpiece, and if there's one instrument that's not quite playing its tune, that is the one that will improve when playing with the rest.
On that point, I was having a little read. It's very interesting about Eliud Kipchoge, the very famous Kenyan marathon runner who famously ran a sub 2 hour marathon, albeit in artificial conditions with pacemakers and people running in a V in front of him, essentially. But the feeling was that he got that orchestra playing perfectly. So he got that combination of having an exceptional running economy, so how efficiently he's using his oxygen, having a high lactate threshold, so being able to sustain that high percentage of VO2 max for a long period. And then, I guess, the other side of running, so the pacing, the tactics, and the biomechanics. I thought it was fascinating. He was able to hit about 90 to 95% of his estimated VO2 max for the whole of those 2 hours, which I thought was pretty remarkable. and probably, in fact, not probably, definitely not achievable for those mere mortals like ourselves.
It's mind-blowing, isn't it? That is absolutely mind-blowing. Having done a test, it's just the most unpleasant. It's everything in your body is just screaming you to stop. Please, please stop, please stop. To sustain that for such a period is incredible. Mike, I'm going to move to wrap this up, and I have a few concluding thoughts on this, which I certainly didn't have before researching this, but I found it fascinating. The link, obviously we all know about a link between being fit and you having a longer, healthier life. More papers that are coming in recently, and this chimes back to the paper on last week's episode with regards to cancer rate reduction in those with structured exercise plans, and why it's more effective than many of the prescribed treatments. This is similar. We're looking at a VO2 max test. This is a metric that, albeit quite difficult to accurately define and test, having such a strong link or an inverse link to all-cause mortality, more powerful than any of the traditional risk factors like diabetes and renal failure and smoking. We should probably be paying more attention to this, shouldn't we?
Yeah, absolutely. And I think that's probably my takeaway too. I guess the counter to that, as we've already alluded to, is look, to get the gold standard, to get it really accurate, you have to go for this testing, which is not very accessible. And it really just begs the question then, what benefit are you getting from knowing your VO2 max? And I think previously I would have said, well, probably not that much because it's a number. What does it mean? There are more important things to consider. But I think, as we've alluded to, actually there may be some benefit here in at least knowing a kind of estimate. I've mentioned it already. I think my takeaway here is just that driving force of having a number in front of you where you can look at that gives you a really good estimate of your cardiopulmonary health. Knowing that number is not suddenly going to reduce your risk, but actually being aware of that, perhaps that being a driver to working on those factors could be really useful. I think we haven't, clearly we haven't touched upon some of the more in-depth roles of it. CPET testing is actually very common in hospital wards pre-surgery. The feeling is that if after the CPET testing your VO2 max is below about 15, I believe, you're considered potentially not suitable for surgery. So there are other uses beyond this rather than the weekend warriors, as you say. But I think an area that is interesting, one to keep an eye on, and I do think there will be more awareness of this potentially as we move on in terms of preventative health, in terms of longevity, and maximising your health long into old age. Matt, I can't finish without asking you, and I know our listeners will be dying to hear this, but what was your VO2 max when you went for your CPET testing?
I think it was 52.
Elite.
I don't know if that was elite. Yeah, I think it was 52.
So no sub 2 hour marathon in the near future, but pretty good.
I'm going to just move us on. Mike, thank you so much again for exploring an interesting topic with me. Listeners out there, like Mike said, it's great to have you along with us for this journey. And if you could tell a friend about the show, if you could hit the subscribe button or leave us a review, that would be much appreciated. And we'll be back in a few weeks' time with another very interesting, very special guest, actually. So I will see you then, Mike.